Hello everyone, we're Team 4, the Composting Queens, and for the U21 challenge, we wanted to explore the topic of food waste in healthcare.
Hello everyone. Annually, healthcare accounts for 5% of the global emissions. And as you can see in figure 2, 20% of these are due to food and food products. So we want to see if we can mitigate the effects of food waste by this industry. Food waste contributes about 10% of the greenhouse gas emissions annually, and it's very poorly studied in healthcare. It's estimated that thousands of tons of food is wasted by this industry every year. The reason why this is a problem is because most of the food ends up in landfills and gets converted to methane gas. There's increased transportation fees and waste haulage fees. It leads to deforestation and decreases the water quality. So by tackling the issue of food waste in healthcare, we can improve our health and also the environment.
Because of this, we wanted to explore what food waste management practices the healthcare system can adopt to improve sustainability and lower greenhouse gas emissions. We explore a few strategies to lessen food waste, including standardized meal portions, which enhance efficiency but decrease flexibility. Industrial uses incur high costs, food donations and feeding livestock had safety and regulatory concerns, and centralized kitchens save labor costs but were inflexible. After thorough consideration, we found that decentralized composting had more benefits than cost.
Composting is a natural process of decomposing organic matter into an eco-friendly, nutrient-rich soil enhancer. This can be centralized where organic matter is collected and transported to a large facility for processing, or decentralized where composting is practiced locally. It is uncommon practice for many places, including hospitals. So in this case, we are going with decentralized composting. In implementation of decentralized composting, hospitals can do the following: assess waste generation, allocate space for composting and collection of the compost, identify the method of composting they want to use, educate staff and patients about composting, have regular maintenance of the composting sites and practice safe composting methods, and lastly, utilize the final product in their gardens and sell it to local farmers.
Decentralized composting offers key advantages, such as reduces landfill waste and associated costs, decreases methane emissions and greenhouse gases, engages community in local waste management, stimulates local economy, provides cost-effective hospital waste solutions, and also improves soil fertility with nutrient-rich compost. Challenges and potential solutions for decentralized composting. The first challenge will be traditional way of handling trash, fear others or pests. And the solution will be campaigns and workshops on composting, educating the staff and community members. The second one will be time-consuming and high maintenance, and the solution will be local jobs and volunteers and maintenance every few days. And the last challenge will be limited space near the hospital, and we will solve this by collaborating with the community and farmers.
Education is the most simple and cost-effective way to make composting a success. It educates patients and MDT about the relationship between climate change and healthcare. It empowers patients to take action upon themselves, and it also addresses many of UN 17 Sustainable Development Goals. Here's an infographic poster which shows many success stories of other hospitals that have implemented composting as a food waste management strategy.
There are several ways that hospitals can fund composting programs. Many hospitals have funding set aside for sustainability, and they can also reallocate their budgets to improve food management. Hospitals can apply for government grants like the Eco-Action Community Funding Program and the Green Municipal Fund. Additionally, the Agricultural Clean Technology Program helps with adopting composting technologies, making this process easier. For this reason and the reasons that we presented before, we think that composting might be a really great alternative for fighting the climate change related with the health area.
Let's transform hospital food waste into a sustainable legacy, nurturing both health and environment for generations to come. Thank you to all of our team members for contributing to our project.